Hello, my name is Lance Ustida, and today will talk to you about the peer support in your community and how you can help. Picture this, you're a veteran deployed to an austere environment, running and gunning between different missions. A loud explosion, a crying child, the sound of explosions in the background, the death of a loved one while in combat operations, the feeling of guilt as you were the only one who came back alive. Night after night, you awaken in a sweat-soaked bed. Now you're at home, away from the trauma and combat, away from the explosions and post-pounding attack. How do you cope with the nightmares and the guilt that you have? You return back to sleep, but all you can think about is what you went through. You try to explain to a new therapist that the VA gave you, but they aren't listening. Research states when in a constant stressful state of mind, when deployed, the brain begins to function differently, so that it can be better suited for survival in the harsh elements that come with war. Cognitive thinking may be affected when soldiers face life-threatening situations for an extended period of time. This can last when they return from a war zone, possibly leading to trauma caused by the war. Beyond the psychological changes that happen in the brain, war can cause people to change dramatically. This can lead to relationship problems and a host of other mental disorders. So you ask yourself, there has to be someone who understands what I'm going through. But who? Who do I turn to? As you may realize, this situation affects many people today. According to the RAND Center for Military Health Policy Research, 20% of the vets who either served in Iraq or Afghanistan suffer from either major depression or post-traumatic stress disorder. 19.5% of vets in these two categories have experienced a traumatic brain injury. These three service-related disorders alone have an enormous impact on the demand for veteran mental health treatment. According to the Department of Veterans Affairs, a total of 20 veterans commit suicide each day, which is an alarming amount that needs to be concerned. In our local community, we currently have a large population of people who are needing help and have nowhere to turn. Due to the overcapacity level of the local VA clinic and the inability to seek a solution. One of the biggest challenges that veterans or anyone suffering from a mental substance abuse illness is the inability to find a therapist or counselor who actually understands what they are going through. According to the North Carolina Department of Health and Human Services, the mostly rural area of North Carolina has a shortage of mental health professionals in primary care area. With less professionals here to help people suffering with mental health disorders, it is hard for even veterans to find help with these problems. The DoD VA Clinical Practice Guidelines recommend clinicians consider using group treatment for PTSD, as group treatment can improve health outcomes. Data indicates several advantages to offering group treatments to patients with health outcomes. Data indicates several advantages to offering group treatments to patients with PTSD from an administrative perspective. Groups offer increased efficiency in treating multiple patients simultaneously and are cost-effective means of training therapists and providing trauma-focused therapy, since most groups are co-led by two therapists. From a clinical perspective, groups provide an important opportunity for patients to interact with others who share the same experiences, which may reduce the stigma and sense of isolation many patients with PTSD endure. The supportive group environment also allows patients to rebuild a sense of safety and trust, which is particularly important for their social function. Lastly, group formats also provide a built-in social network to provide support and increase commitment to therapy and level of engagement, which is extremely important considering that patients with PTSD have historically high attrition rates ranging from 20 to 38% due to their symptoms of avoidance. One novel approach is the use of guidance of a peer support specialist, as someone who has been on that same road as that person and can guide them to an ability to overcome their illness. As a person who has traveled a similar path, peer support specialists foster hope for recovery and role models that reality to the peers they serve. Past research shows that disclosure of traumatic wartime events can have mental health benefits for veterans seeking help. By having local groups set up, a veteran can come in and talk about their issues and have a plan to wellness. One of the biggest reasons that this solution would work is by having someone who actually knows what the patient is going through. By having a large local group assigned with a supervising physician or therapist, a step-by-step approach of finding wellness is achievable, and finding that a cure can be accomplished. Peer support specialists help peers create individual service plans based on recovery goals and steps to achieve those goals. They also use recovery-oriented tools to help their peers address challenges. They assist others to build their own self-directed wellness plans. They help support peers in the decision-making. They set up and sustain peer self-help and educational groups. And they also offer a sounding board and a shoulder to lean on. So the targeted market would be veterans who are suffering from mental health, substance abuse, and TBI issues. Along with that would be female veterans who have suffered from sexual assault or domestic violence would be included. The team that would be included would be a supervisor and provider, such as a psychiatrist or psychologist, a support therapist, such as an LCSW or MSW, peer support therapists, and also volunteer staff. So you may ask, how are you going to pay for this? Currently, Medicaid is the main payer for peer support services, although many state departments of behavioral health offer grant funding for these services. Currently, 39 state Medicaid programs cover peer support services for either individuals with mental illness, individuals with addiction disorders, or both groups. If state Medicaid programs cover peer support under the fee-for-service benefit, the health plans are also required to cover these services. Some states have special provisions that allow them to only cover peer supports for limited groups of individuals, such as those enrolled in managed care. Some states allow peer support specialists to act as a quality health care professional for certain types of behavioral health services, but do not allow for the specific reimbursement of peer support services. Currently, our services here at our group are minimal, as we are able to obtain space through a public library along with donations from local 501c entities, but of course donations are always accepted. Currently, with groups in the local area, we have helped over 100 veterans who have been suffering from mental health issues. In this aspect, many veterans have seen an improvement of their well-being since coming to groups and made plans to further their careers, education, and finding an outlet that they can finally see the end of the road. With a bi-weekly session, working on finding room and assistance for all female veterans group is in the future. So what can I do? One of the biggest things that you can do is to spread the message to those that may need to seek our assistance. If you or a loved one are still having trouble with mental health or substance abuse issues, contact our group for assistance. You can also help by helping to donate to our fund, or with Wounded Warrior Project or the Super Fine Fund, who are assisting us with the in-kind grant funding to continue our services. You too can help those who are fought for freedom. If you're interested in supporting your local veterans and interested in creating another group in your area, contact your local NAMI chapter and ask about obtaining training to become a certified peer support specialist. As always, never forget that those who have fought for our freedoms and have given so much to help us. Day by day, these people leave our environment all the time. So the best thing that we can do is always help. So always remember to never forget. In the end, I'd like to ask as well, if you or your loved one is experiencing mental health issues, please call the National Suicide Hotline at 1-800-273-TALK or the Veterans Crisis Hotline at 1-800-273-8255. There are always operators and staff available 24 hours, 7 days a week. Thank you, and I hope that this information is beneficial for everybody who's here and they can actually understand that there's always people here to help you.